Hello and welcome to another week of Core Balance Coaching. This week we're going to be doing a video that I have pre-recorded, just finished it right now. And so we're going to start out with that, and I'll be press and play on that in a minute here. And before I do that, I did want to make a couple announcements. One, we're doing an Instagram challenge where we're going to be giving away 10 months of core balance training. So to 10 different people, we're going to give away a month of core balance training. So for people that use Instagram and want to do a challenge, we're going to be picking 10 of you if you can complete the challenge. So check that out. Another announcement is we're going to be reopening comments in the lessons of core balance training for better organization. And so you guys may, if you're a student, you may have seen that there are old comments from down below the lessons. So we're going to be reopening that. And so I think that's really good news, convenient for you guys to be able to ask questions about a specific lesson, and for us to just be able to stay organized. And the Student Hub is going to be used also for questions, and also just the challenges, which have been super powerful. We have a Student Hub Student of the Week, which I'll be announcing after this picking up a baby video. And so that's going really well. And then the Student Hub for just other types of, benefits, like connecting with each other, finding, a community in this journey that we're all on, finding an accountability buddy. There's so many different benefits of the Student Hub. So those are just some of the, announcements. Let's get into this video. Hopefully it works. I haven't done this in a while, so forgive me. I'm just going to switch screens here, and the video is going to start automatically. So here we go. How to, my recommendation on picking up a baby. Today's video is on picking up a baby or child or another person. If you have to pick up your grandparent, these techniques will apply to that as well. We're going to focus on body position of both you and the baby. We're going to focus on technique, and we're going to focus on core engagement, which is the #1 critical factor, I think. So we're going to do two different locations. We'll do the crib and the floor, and I'll focus on core engagement when we do it on the floor. Okay, so for the crib, we're going to focus on body position and technique. And we're going to start by, I'm going to put the baby down in the reverse of how I do it. We want to get as close to the person or baby as possible. So I'm right up against the crib. We want to, so that's our body position. I'm going to use the deadlift technique, which that's a different video if you want to know why, but I prefer the deadlift technique. And we're also going to have the baby in a position, or the person in a position that is optimal. I'm going to grip the baby from the torso, not under the shoulder, not lifting from the armpits, but gripping the torso. And we're going to set the baby down first, and I'm going to explain how I pick him up. So close as possible. I'm going to grip him here. I'm going to get him facing me. And I'm going to lean back. This is the technique portion. So I'm going to lean my body weight back and use the baby's body weight as leverage. I'm going to lean. Part of me lifting him up is the leaning back, and the body's weight counterweights my weight. It actually makes it significantly easier because we're using leverage in our favor. So there's lever arms and physics and all this stuff, and if you're just bending straight down and lifting the baby straight up, it's a lot more torque on the spine rather than leaning back, and the body's weight counterbalances it, and then I use that lean back. You're going to have to practice it. It's very helpful. It makes it a lot easier. That leaning back shortens the lever arm. It makes it a lot less torque on the spine. Okay? So that's body position of you and the baby. Technique. Let's go do core engagement. Core engagement. So this is the #1 most important thing. So I'm going to set the baby down in reverse. So butt back and get him in an ideal situation. Hi, baby. Hey, baby, you happy boy? You happy boy? Okay, so baby's position is pretty optimal. My position's pretty optimal. I'm gonna get flat feet. I'm gonna get down as low as I can. I'm hinging at the hips, and my knees have to bend this far for just my flexibility. And I'm going to, before I lift, I'm gonna make sure my core is engaged. It's absolutely necessary to protect your spine. So what I do often is I do a kind of a test lift. So before I actually lift, I just feel his weight, and that sometimes engages my core. So every time it engages my core. So I'm gonna just get a little test. Oh, okay, I'm engaged, and now I know his weight, and I'm gonna do the real thing. Lean back and up. And so get another side view, and they can really see me lean back. This is a really beneficial thing. So butt back, down. Hi, baby. Okay, so here we go. One more time. You can do this, baby. Lean back and up. And my core is engaged. If you want to know how to engage your core, connect to your anchors. And if you don't know what that means, the best thing I can do is refer you to the free trial of core balance training. You can learn what connecting to your anchors means just in the free trial, and that's really all you need. So hopefully that helps. And if you enjoyed this video, feel free to support the channel by hitting the like button and telling your friends. Tell somebody that you know that has a baby if you think this might help them. And the last thing I want to mention is with a stroller. So just in addition to all the things I mentioned, with a stroller you always want to make sure it's locked, because leverage is really important here. And if you go to pick a baby up from an unlocked stroller and you try to use this technique, it's really going to work against you. So make sure you lock the stroller, and this makes it really easy to use this leverage technique. So watch my weight off my heels. Now I've got the baby, I've got good body position. I'm going to lean back, and it shortens the lever arm and makes it a lot easier for me to lift the baby, a lot less torque. And of course my core is engaged the entire time. So if you found any of this helpful, feel free to support the channel, hit the like button, tell any of your friends that you think this might help, if they have a baby or a grandparent that they have to lift off the couch. This technique also works for that. So hopefully that helps, and take care. Bing, bang, boom. Thank you for the cue that my mic was still off. I don't know what I just said, but I think I was thanking Kai for being the perfect model for this video topic. And yeah, he's super cute. So thank you guys for the nice comments. And also, yeah, I will pass the info on to Kai about his cuteness levels. So let's get on to the next thing. I think we've got our weekly tradition of announcing the Student Hub Student of the Week. And I got to do a quick thing here. Give me the sec. I believe it's going to be, here we go. So Student Hub Student of the Week is officially, let me see, I think it was off, isn't it? Pamela O. So Pamela O is the Student Hub of the Week because she got the most points. So like I said last week, we now have an objective system for choosing the Student Hub Student of the Week. And so Pamela, congratulations. We're going to add a month to your membership. You have to do nothing. We will add it from the back end. And she got 522 points so far in September. So this is our second week of doing it this way with the new Student Hub. I love it. We've got all these challenges going. And just by completing these challenges, not only do you potentially get to be the student of the week and get another month to your membership, but also you get the side benefits of the things that it's doing for your body by staying accountable, by doing your daily routine. You're most likely going to improve your outcome, and I think that's the more important benefit. So we're just recognizing you this week, Pamela, for completing the most challenges, and also you get points for other things too. I think for responding to another student's question or post by replying, you get points for that. You get points for posting something inspirational, and they can see, they have those inspirational emojis. If you get those on your post, you get, I think you get a few points for that. So cool stuff. We're still learning, as you probably are too. But yeah, go Student Hub and go Pamela, and I look forward to seeing who it is next week. And on that same note, I mentioned the Instagram challenge that we started like an hour or two ago. So if you have Instagram, check that out. That's another way to get extra, to win a free month of Core Balance Training membership. And so I guess now that we switched to this monthly membership style, it's a lot easier for us to hand out these kind of things, just handing them out like candy. So do the challenges. That's our goal, is for you to stay accountable. That's the most important thing. And you get benefits for that, lots of different types of benefits. And this Instagram challenge, I think, is going to be really awesome. So check it out. Just check out the announcement post from this morning, and it will help spread the word about core balance training and how it's impacting you or benefiting you, or whatever you want to share. Share your truth. Okay, so I guess we're going to go into the next section of the stream, which is chat comments. And because we don't have any prepared questions for today, which is great. That means our Student Hub questions are getting answered by our awesome team. So thank you guys. I'm just formatting here a little bit. See if we can fit this all in there. That looks good. All right, so we're going to the top. Top question is, why can't I access the top? Looks like there's a question above where I can see right now, so I don't know if there's a glitch, but I see a question that says swished right here. That's weird. If anybody wants to help me figure out what that question says, I would love to know. Let's see. Here we go. I think I got it. All right, David Haynes. When lying face down, I can't prevent my nose from being squished. Oh, okay. Yeah, so that's going to be a postural thing. Ideally, you want to be able to get your forehead to connect to the ground, and if your nose gets squished, I think my nose gets a little squished, but if it's the primary thing supporting your face, that's going to be uncomfortable, and you want to lengthen ideally, posturally, we want to lengthen the muscles in the back of our neck, and that will help with being able to, not have a forward head posture, is where your chin is jutting forward and your forehead is actually back. So, in relative to your chin, so that would make your nose and chin be contacting the ground. So, something to work on. And in the meantime, David, what you can do is you can bring the floor to you by using like a rolled up towel, like a hand towel or a washcloth. Just roll it up to the thickness that you need and bring the floor to your forehead. So that should help for anybody else as well that's having that kind of problem. Clifford just completed module 5. When performing back anchor challenge progressions, I feel a strain in my lower left abdomen, like I may have injured it. I don't get pain during any other movements. Best thing I can say here is listen to your body. I mean, that's your body's communicating to you. Something's going on, a strain. You know, if your intuition is telling you strain, then you might be right. And so maybe you've been pushing it a little hard with the exercises, the strengthening exercises, and your abdominal muscles need a little break, a little rest. So that could be the body communicating that. I encourage you to listen to that communication always, and do the other movements. You say you're not feeling the strain during other movements. So during this time where you're just taking a break from that one exercise, do the other stuff that's not causing you that kind of bad feeling, it seems like. And then when you get back into the back anchor challenge, Clifford, do it in a subtle, progressive way. So don't just jump right into it and extend your legs all the way. I mean, I think a lot of people tend to err on the side of extending their legs too far as it is anyway. I don't even extend my legs very far still, because the magic is in the core connection and control, not really the leg movement. So I'm much more focused on my core engagement and staying connected to my back anchor than how far my legs are pushing out. Stian, should the glutes feel hard and activated during dead bug? Same exercise, back anchor challenge, dead bug, just a different focus. Not really, Stian. I mean, I'm going to go ahead and say that the glutes are definitely not a major muscle as part of this exercise. The abdominals should be very hard and activated. The glutes could be an accessory muscle, slightly engaged, but they're not going to be major participant in this exercise. And yeah, coming to us from Norway, I love it. Thank you for always reminding us that this is a global thing, global problem, global solution. So yeah, glad to have you here, Stian. Francis Logan, how can you tell the difference between having issues with your SI joint compared to with your hip joint in terms of referred pain down the legs? That's a good question. So SI joint is very specific pain. It's going to be right in that spot that I've showed in previous videos. I can point to it right now if you want. My mic's going to be in the way, but right there. Okay. It's very specific, and that's where it's going to be, because that's where the SI joint is, and the pain is in the joint if it's the ligaments. If it's referred pain, as you mentioned, the SI joint can, because there's nerves that go through the SI joint all around it, can refer pain all the way down the legs. Yep, it can refer pain into the thigh, into the calf, even into the foot. So the hip is not really typically, the hip problem is not going to have that kind of referral ability, because the nerves that go into the hip kind of typically end in the hip and they don't continue on. The sciatic nerve continues on, but it doesn't actually go to the hip. I mean, branches of the sciatic nerve go to the hip, but the the nerve itself is not going through the hip joint. So your hip pain will be more localized. So hopefully that helps. I'm not sure. Let's see if we can get back to this. We're on this question here. And I'm not sure if that answers it, but yeah, referred pain down the legs is going to be more lower lumbar or SI joint nerve compression. Yeah, okay. Kushigayal, hi, I'm still working on my basics with front and back anchors, unable to match up with progression of the program. Should I try to progress to the best of my ability? So this is really good for anyone that may feel this way. There is no reason to need to progress through the program at any rate. the best rate to progress through is the rate that matches your comfort level and your confidence level. So just I don't recommend looking at each module like week 1, week 2, week 3. We actually changed the names to modules so that you don't associate them, that you need to do them one each week. This is lifetime stuff. So it doesn't matter if you learn this. The faster you learn this, actually, the less likely it is to stick. The slower, the more time you spend on this, you can get this deeply ingrained. And so I really think there's massive benefit in progressing at, just really trying to download this stuff into your nervous system as much as possible. And the other way to look at this, Kushi, is that you can also progress, while still working on the previous stuff that you don't feel fully confident with. So you can start module 3 while you're still really heavily working on module 2, just to expose yourself to that stuff. So yes, you can progress, but there's no benefit, zero benefit in going through the program faster. The most benefit is gained by going through the program at your pace, at your own pace, where you feel confident that you have made these connections, that you can carry it on into the next phases and seasons of your life, not just the program. This is much more than just the program. Also, is it possible the progression exercises could cause more soreness with symptoms? Yeah, definitely possible. Your extra library educational notes talks about sitting cross-legged. Would you recommend sitting on a floor for my condition, left SI joint? Cross-legged is going to stress the SI joint. So if it's an acute SI joint, like phase 1, if you watch one of my SI joint videos I talk about, is it phase 1? Is it a time where you need to be avoiding things? Or is it phase 2, where you need to start reintroducing those things because you've kind of stabilized it and it's getting better? If you're still in phase 1, you should be avoiding sitting cross-legged on the floor because that stresses the SI joint. But you do need to eventually reintroduce that. So you need to do the work to stabilize it, and then gradually, maybe not go straight to cross-legged on the floor, but gradually work your way down, and by getting creative. With weather changing in the fall and this winter, I'm in Wisconsin. Walking outside could be difficult. I want to resume my spinning bike slowly. How should I resume? Core cycling. So it's like riding a bike, right? Spinning is riding a bike. You want to do it from your core. So all of your focus is that your source of power, the drive for the pedaling and the handlebars, everything, your center of power is your core, and that is what's driving the motion. That's my best recommendation for people that ride a bike. Marta, finishing phase 1, going slow, seeing progress, and so grateful, Dr. Ryan. Thank you, Marta. Recently, when I do back ankle progression 2 and butt buster exercise, my quads fire up and not the core or hamstrings. Any advice? So this is a common problem. This is a predictable pattern. This is a kind of a unhealthy movement pattern that I've been in and sometimes fall back into. And we want to get out of. We want to be heavily using our abdominals and deep core and glutes. And when that happens, we feel the burn and the work in those muscles. When we feel it in the quads, that's very predictable pattern for quad. It's called quad dominance. It's a limb dominant movement pattern. That means that's what's dominating the movement. So tone it down. So my advice is to turn down the intensity, focus more on the quality of your engagement and and focus on, really turn it down a lot, real low intensity, and just really focus on the core, kind of reset your system to start the pattern the right way. We don't want to build on an unhealthy pattern. We want to set the pattern, set the tone, and then build on that. And so if you just continue to do strengthening and it's your quads, you're strengthening an unhealthy pattern. So I say tone it down. And another thing you can do, that like a hack that will help like trick the body, is do the bridge on the foam roll. So put the foam roll under your feet, or what I prefer is under your thoracic spine. And if you overuse your quads when you're on the foam roll, you will start to roll away. So it really causes you to activate your glutes, hamstrings, and abdominals to do the bridge more so than the quads. So that's what I recommend for you, Marta. When I just started them, I didn't have this issue. I checked the core and it's engaged. Okay, cool. So another thing is, it's the same thing. Turning up the intensity can cause you to resort back to an old movement pattern, because the more intense things get, the more stressful, strenuous it is on the body, and the body will resort to deeply ingrained patterns. So, same thing. Brenda Brown, Kushi, you said you're giving her just positive advice. Yes, I love this advice, Brenda. I go back to the basics. Well, I mean, right now I do it every day because I've been traveling a lot. We're right now in an Airbnb, which is why we filmed this video now, because our house is embarrassing. Our one-bedroom ADU that we live in at home is embarrassingly small. So we were like, let's do it here. So, excuse me. So that is what I've been doing. I've been traveling a lot, and I've been going back to the basics, and it's really still benefits me immensely. Brenda, I will stay here daily until I'm certain that moving forward won't cause a setback. I love it, Brenda. You are a model student. Kushi, yes. So just communicating with Brenda. So Kushi, this is a logistical question, so I would pass this on to the support team. Marta, agree, going slower feels like it's helping. I'm afraid to move too fast. Do more of what feels good. This is a great conversation. I don't know if you guys need me. You guys learned some central tenets of the program. Bridge with feet on the foam roll. Hey, look at that. I mean, Jesus, this is what I just said. And, oh, wait. It's impossible to activate glutes. Only my hamstring fires up after core. Glutes are soft. Okay, so this is a little bit different, actually. So, Stian, this from previous weeks on these live streams, I remember you're having trouble with your glutes. This is not as common. So one of the things that I would recommend is potentially seeing, if you have the ability to see somebody in person who can test your glutes to see if you have a real like gluteal amnesia where they're not working, they're not turning on. And if so, then steps need to be taken to figure out why. If there's a nerve compression, it seems unlikely because it's bilateral, both sides. Usually something like that would be more so on one side, definitely more common that way. But, are you able to squeeze your glutes, just standing, squeeze your glutes, crack the walnut? I think I mentioned that like in a previous week. You got to be able to do that. And if you can do that, then you have the nerve connection and you want to build on that. You want to apply that ability to the bridge and all these other things. Stian. Catherine, I'm doing better with standing, sitting, and walking, but still have considerable pain kneeling and sleeping. Okay, just sharing. We can talk. I have put out a sleeping video, so I got to refer you to that because it's a big topic. I've put out a sleeping video on YouTube, so check that out. And kneeling, where's your pain kneeling, Catherine? If you answer, I would love to get that information before I can comment more. Meredith, hi there. I have a couple questions I'd love some guidance on. On my front anchors, I can connect pubic bone to floor and push off rib cage. Excellent. But my lower back muscles feel very engaged. Any tips? So this is not uncommon. Turn down the intensity, Meredith. Turn this into just like a real light meditation and just super focus on your abdominal muscles. And then once you can feel like you have control over that and your lower back muscles can stay a little quiet, then you can gradually ramp up the intensity. So that's my advice there. Your next question, how to release lower back muscle tension when sitting. I push away from sit bones, but my lower back still feels very engaged. Is there a way to give those muscles a break when sitting? This is something I struggle with myself. I just don't love sitting, and I just kind of avoid sitting when I can. I'm sitting right now, but I could probably use a standing break after the stream. Sitting is we overdo it, and it might be just the body communicating that, like, I'm done sitting, like, go move around, it feels better. How else would the body communicate that? Pain and muscle tension, they kind of go together. So the push away is one. Supporting with a backrest works for some people. Switching it up, not staying in one position for too long. Lumbar support can work for a little bit, but it can't work for 2 hours or longer, maybe 15, 30 minutes. And then switch it up, backrest, a different style of support, and then standing breaks and stuff like that. That's my best recommendation for sitting, because sitting just isn't, it's like, how do you smoke healthily, right? It's just not like, it's not inherently good for the body to sit. I don't think there are many health benefits besides the rest that it gives you. And I just lost my place. It's not letting me go up. Weird. Is it because there's people commenting? It's not letting me go up, and now I have this going on. All right. Now I have to find my spot. Sorry, guys. Question 3. My SI joint on the right side feels stuck. Been like this for weeks now. I feel like I need to crack that area, and I still feel some pain there. How to realign the SI joint. So we've talked about muscle energy techniques. I can't demonstrate them right now, but I could do a video on it in the future. One way to realign the SI joint is to put something between your knees, like a little ball, or like a ball would be ideal, that you can squeeze and just squeeze. You can even put your fists there like this, and squeeze your fists between your knees. Squeeze as tight, squeeze as hard as you can, and that will kind of stress the SI joint, but it can create a big pop that will signal the SI joint adjusting its position. So that's a muscle energy technique. There are other ones where you can do the legs going in opposite directions. One hip into flexion, one hip into extension, and with resistance, and that can do some stuff. Or you can see a professional, and they can realign it with their hands, right? But you got whatever you do, whatever style of realigning. Another way is to do the butt buster bridge if you haven't already. That's extremely beneficial for the SI joint, but don't do it with a stretchy band. Tie a belt around your thighs so it's static, and just push out into that as hard as you can, and that can potentially reset the SI joint. So those are 3 different methods, and no matter what you do, you got to follow it up with stabilization. So then do the butt buster with a stretchy band and be pushing out. P.S. I felt so much progress already in just 2 weeks. I'm so glad. Oh, okay, so you're only in 2 weeks. Fantastic, Meredith. So you haven't even gotten to the butt buster yet. You have amazing things ahead of you for your SI joint. And this is probably where I started the video on sleeping. And thank you guys for all the comments. All right, so we've got, okay, cool. Thank you, Kara. Deep gluteal discomfort. Why does my upper glutes feel warm when touched long after I have been doing bridges every time? Warmth is one of the signs of inflammation, the inflammation response, Stian. So they seem like they are inflamed. The upper glutes are inflamed, and there's something going on there. I would recommend seeing a specialist to check that out, Stian, because this could unlock something for you if we can figure it out. All right, let's see where we're at. So this is where I am now, and I've got a bunch to go. All right, it's 12:36. I'm going to take my own advice, and I'm going to stand. Okay, and keep going with this. So we've got Rebecca Shelp. All right, hey, that's my mother's maiden name. Probably shouldn't give that away, but it's one of our family names. I'm having trouble activating and deactivating muscles in the lower back, glutes, hamstrings on the left side, even with complete concentration. Could something else be going on, or should I just keep working it? Yes, something else could be going on. I was just talking about that with Stian. So if this has been going on for a long time, I would consider seeing a specialist to just check out, like, maybe what could be going on. Do you have nerve connection? Like, can you at some point in time ever squeeze your glute? Yep, and if so, then you have the nerve connection, and so there is potentially just the solution is just going to be consistency, persistency. Those virtues do pay off. It's the only way that I know to break out of firing patterns, neuromuscular firing patterns, aka movement patterns. And so, so persistently telling them to do it the right way eventually will break down that old pattern and help start a new pattern. And another way that I believe that you really got to do is you got to start at a low intensity when teaching the body a new pattern, because when you go high intensity with muscle engagement, it resorts, this is the theme of today, it will resort to its most comfortable, most deeply ingrained pattern. Peter Kucharek, hello from Slovakia. Past lesson 2, I have spondy L5 first stage. After 1 year of core exercising, found your program. I feel a little bit better after 2 weeks, but feel. Good to know. Don't have a question there, but glad to have you in the program, Peter, and welcome from Slovakia. Tim Bamer, nose squishing. Add a towel under the forehead and the chin. All right, cool. Thank you for the extra modification there. Forehead and the chin. Cool. Yeah, that does make sense, Tim. Miss Tran, I believe. Can you please explain why pain location moving is a good thing? All right, this is a great question. I'm going to go full screen for this. Okay, so I love this question. Why is pain location a good thing, even moving down? And you say, I also recently got slight warm sensation down my leg, which I never experienced before. Is it concerning? Thanks. Okay, so when I say pain moving is a good thing, I have to be specific that I don't mean pain moving down your leg. Actually, with nerve compression, there's something called centralization of the pain, which means the pain getting closer to the center of your body, closer to the source. So if you have nerve-referred pain down into your feet from your lower back, and you are doing some things that are beneficial for your body, and that pain now only goes down to your calf, that is centralization of the pain. The referral pattern is getting closer to the source. That is a good sign. That's a good thing. But if it's doing the opposite, it's actually going farther down your leg. Now, it was only into your buttocks, and now it's going into your calf. That is not a good thing. That's the pain, the nerve compression progressing. And so that type of nerve compression pain that's specific to nerve compression. But when we're talking about localized pain, like lower back pain in the local tissues and the muscles, in the joints and the ligaments, and that pain moves into maybe the SI joint or the hip, or it moves up into the upper back, the thoracic spine, that is almost always a good sign. And you asked me to explain it, and so I like to give a comparison. So say you've had lower back pain for 10 years, and that entire time you've been doing things for your lower back to improve it, and the pain does not change, it does not move. That is the worst case scenario. Well, the pain getting worse is the worst case. The next worst thing is the pain doesn't change at all, it just stays. Because it just means that whatever you're doing is not addressing the problem. It's not causing the pain to go anywhere or reduce, which is the goal. The next best thing after the pain, I don't know how to say this. The next best thing is for the pain to move somewhere else, because it's a sign that you have targeted the pain. So your pain's in your lower back, you've had it for 10 years, you start doing something new and the pain moves into your hip or your thoracic spine. That means you actually were doing something right. You addressed the pain. It's preferable than the pain going on for another 10 years in the same spot. Now you don't have the lower back pain, but you have pain in your hip. Okay, that's still bad, but at least you've only had the hip pain for a couple weeks, and you're on to something. So that's why it's a good thing. And then the next best thing after that would be the pain moving out of your body and going away. But we're human beings. We're messy. Everything's not clean and smooth. And sometimes you do the right thing, and before it goes away, the imbalance will stay in your body and go somewhere else. And so hopefully that makes sense. Peter, pain in SI joints and walk bad left hip. Okay, is this what is, you start to feel pain in your SI joints and walk bad left hip. Okay, so, all right, no real question there, but you're getting a little bit better. That's the best thing you can ask for, and after only 2 weeks. So whatever you're doing that's causing you to get better, do more of that, double down on that. And, I would recommend to, with the walking situation, listen to that. And if you have, I have put out a video on SI joint pain with walking, specifically a walking video, and I talk about how sometimes the SI joint will hurt initially in the beginning of a walk, but as your muscles loosen up in your body, especially your hip flexors, that pain will actually go away by midway, by the end of the walk. So sometimes you can walk through SI joint pain, and you got to listen to your body. So, but yeah, walking, I would recommend a couple of those walking videos, one in the program, and then there's a couple on YouTube. Christina, what is a flare? I have herniated discs in my neck and thoracic along with degeneration in my cervical and thoracic. So herniated and degeneration. Sometimes the neck or the lumbar or the thoracic have what PT calls a flare. The flare-up is just a description for an inflammation, an increase in inflammation or irritation of the injury. So you have a long-standing injury, and then you go on a road trip, and then it flares up. It's just an increase in inflammation. So that's what your PT is talking about. So if you have increase in pain, that's one of the signs of a flare-up, or increase in swelling or heat or redness. Those are the 4 signs of inflammation. Stian, push away while sitting. Should I imagine floating up off the chair like there was a string attached to the top of my head? No, nope. Because the reason, Stian, is because if you had a balloon attached to your head, like or a string, and it was pulling up, you would actually be pushing into the chair less because you're lighter. right? If something's pulling you up, your body weight is getting pulled up. And so that would mean you're pushing into the chair less. So instead, I would recommend thinking about sinking down into your body weight going down into the chair and pushing away from it. So you're heavier. Your body is heavier, opposite of a string pulling you up. And then you can push away. And guess what happens? By pushing away, by being heavier and pushing away with your sit bones, gravity actually gets recycled through you and you become taller. And that is at the point where you could imagine a string maybe lengthening your spine, but don't let it reduce your ability to push down. The primary thing is low center of gravity, right? You talk about that in sports, you talk about that with agility. We want a low center of gravity. We don't want to be up high in our body. We want to be down, anchored down into the chair, heavy into the chair, push away with the sit bones, and will automatically cause us to get taller. How is that possible? Well, we're recycling gravity through our bodies, and we're using it to our advantage. So hopefully that helps. And the string on the top of the head, yeah, that's good for like a local, like lengthening the back of the neck. Like imagine lengthening the back of the neck. That's where you want to be tall, but not the whole body. Hopefully that helps. Hi from Denmark. All right, Inger, welcome from Denmark. Peter Hafner, could you talk a bit about lumbar stenosis and how these exercises will help? I'm scheduled to get a shot to numb the pain at the end of the month. Curious to hear your thoughts. So lumbar stenosis, there's two types. We'll talk about the more common type that's more addressable, which is lateral or foraminal stenosis. And this is, you can imagine, I don't have my Scully here to demonstrate, but backward bending. So it's the closing down of the back side of the spine. So backward bending will close that down more. Forward bending will open the back of the spine. It's just physics, right? But forward bending is not a solution to back pain. It's just showing you that you know, if we bend this way, then this part opens. Okay, if we bend this way, then sorry, I'm backwards. This part opens. So we understand that stenosis is worsened by backward bending. Well, posturally, the predictable pattern of posture of anterior pelvic tilt is the equivalent of a increase in lumbar lordosis or backward bending of the lumbar spine. It's just sitting in a more backward bent position. And so we want to reduce the anterior pelvic tilt or the lumbar lordosis, not completely make it go away because there is a healthy amount of curvature to have in the spine. But the problem occurs when it's excessively backward bent, which is very common. So that's one thing. Another thing that can cause stenosis is just the discs are degenerated so bad that there's less space between the vertebrae, or the vertebrae have the vertebral level has become so unstable that the body is building bony deposits to try and attempt to stabilize the joint. So that would be like a natural fusion. The body's has bony buildup around the joint, and that closes the space for the nerves and blood vessels to come out. So that's another way stenosis can form. Will the exercises help? The exercises will help with the postural cause. It will not necessarily reduce any bony buildup, but it can, by supporting the spine. These exercises are designed to support the spine, provide more support and stability for the spine so it doesn't feel unstable. It can prevent the progression of bony deposits forming or growing around the spine. So it can stop the progression of that. It can definitely improve posturally the space between the vertebrae. And the other cause, degenerated discs. So yes, you can create some decompression in your spine subtly through increased intra-abdominal pressure with your breathing and just better squeezing of the spine through the muscles that surround the spine. If you have a better corset around your spine, then the spine does decompress a little bit and get taller. So hopefully that makes sense. Stein, when I do the back anchor challenge, do I go above 10%? Yes. Yes, also in the bridge. The 10% rule is most appropriate for back anchor awareness, front anchor awareness, the low level awareness stuff, and also just sometimes just cruising around your daily life, sitting, walking, 10%. We're doing strengthening exercises. I'm going to be going above 10%. Good question. Sandra, oh, look at that. I totally forgot to go back to my chat. Sandra, hi, I'm in week 6 now. I suspect I have SI or hip flexor imbalance. Makes it worse when driving. Yes, that's true. Should I do other additional exercises because I think my core is strongish at this point? If you're in week 6, then you're probably around the time that you are going to be introduced to the single leg bridge, which is extremely beneficial for a left-right imbalance in the SI joints or hip flexor. So I would consider that. For me, because I have the same problem with driving long distances, single leg bridge on the right leg helps me to lengthen my right hip flexor, which is the one that gets tight from driving. So that plus the butt buster, and you can even do the butt buster, single leg butt buster bridge. So try those. Tim Bamer, I have L4-5 disc bulge to the left. Can I continue my McKenzie method back extensions on teeter inversion while doing CBT? I think my body wants to. Yes, you can. Nothing conflicts with core balance training, so absolutely you can. And then the goal would be, if your body likes McKenzie method back extensions, fine. It's not for everybody. It's not going to be for people with stenosis or spondy, but a disc bulge can benefit from, that's like the main, if not the only thing that I think McKenzie method really benefits as far as back conditions. Teeter inversion, yeah, it's if it feels good, it's not going to contradict. And if these are dependencies and you want to get off them, then you can kind of gradually wean off them by increasing the space of time between the time doing them. Good question. Michael Ross, I have fusion as a L4-5-S1. If I have pain in my left lower back when doing the supine walking, should I stop short of the pain or work through it? I would, because of the fusions, I would stop short, or it's going to be somewhere between that. So, yeah, you're going to go right up to the edge of the pain, but not into it. So right up to where you can and work there. So strengthen at the point just before the pain. So yes, stop short is the right term. I wouldn't work through it because of the fusions. And you also have to differentiate between the different types of pain. So is it good pain? Is it, there is such thing as good pain. So if it is good pain, go with it. If it feels like intuitively like this is bad pain, my body's communicating something bad to me, then do the former advice. Miss Tran, where are we here? Lost my place again. Why does that happen? All right, here we are. I find, okay, so if we haven't already, yes, we have. Perfect, Osti, thank you. Ms. Tran, I find Running Man and Typewriter Squat more on frontal plane instead of transverse plane. That is correct. Yes. Well, Running Man is more sagittal. Typewriter Squat is more frontal. Neither are really transverse. Transverse would be rotational. Is there a chance that SI joint pain is caused by imbalances on the frontal plane instead of the sagittal plane? Absolutely. More often than not, SI joint pain is caused by frontal plane imbalances. But before you can restore balance in the frontal plane, we have to develop stability in the sagittal plane, front to back stability. Otherwise, you can create a new problem of twisting, which is the transverse plane. So sagittal stability, distal mobility. So then you learn how to move your limbs and your more distal parts, like your hips and your SI joint. Okay, Brenda Brown, do you have a link to demo using the foam roller during a bridge? Yeah, that's in the program, Brenda. It would be module 3, I believe. So I think you read about there. I think you were the first 2 weeks, right? And then this is the no more questions point. Last question. And then I will go for 4 more minutes. So I'm going to go till 1 o'clock. We have Sindhu. I have radiating pain in the left leg due to L5S1 disc bulge. I'm following. What movements do I need to avoid? Disc bulge is not going to be cookie cutter, because the reason is because the bulge could be in so many different places. It could be pushing on different nerves. There's almost infinite variability for what a disc bulge could be. So there's no cookie cutter things to do or avoid. Mackenzie method works for some people with a disc bulge, like I think it was Tim, but it doesn't work for everyone. And they both have a disc bulge, right? But it only works for one person. So there's no cookie cutter. But what I can say is listening to your body becomes even more critical, even if it's not the most critical thing already, which it is. It becomes more critical with a disc bulge. So you got to listen to your body and just avoid the things that your body is telling you through communication of bad feelings and pain that it doesn't like, and do more of the things that it's telling you that it likes through good feelings. And you also want to differentiate between good pain and bad pain. So that's an intuitive thing. Does it feel like, okay, I could push through this and it might be okay? All right, let's try it. And then the other advice I have is don't do too much in one day. Don't do 2 new things in one day that you've never done before. Only do 1 new thing per day that's new to you, and then wait till the next day and see how your body responds, because there's a delayed response. And then if you did well with it, no setback, no flare-up, then you can introduce a new thing. If you didn't do well, then you learned, oh, that's the one thing that caused the problem. But if you did 2 things the day before, you don't know which one it was. So you didn't learn anything except one of those 2 things was a problem. Hopefully that makes sense. Catherine, kneeling on a kneeler at church. You were the one from the beginning. Kneeling on a kneeler at church. Pain is in the lower back. Okay. I'm not familiar with the exact body position of a church kneeler, so what I would recommend is to engage the push-away concept and be over your body. So kneeler might cause you to want to lean forward a little bit, over your knees. Try to see if you can be balanced, almost like you're on a unicycle. And you have to be balanced, and so your lower back muscles don't have to work so hard to hold you up if you're more centered and balanced. So I'll take a look at a church kneeler to see a little more, and we'll go with one more question. Meredith Loudon, I think you already had a question, but I don't see any more. Oh, I see Sandry. I haven't answered a Sandry question yet, so we're going to look at this one, and there's a bunch more. Sandra Cheery. Are there any considerations not to do's when there is arthrosis in the lumbar vertebrae? So arthrosis is just long-term arthritis. Most arthritis that people think they have is actually arthrosis. So whoever your doctor is or whoever you found that word that's the right way to call it. Most people call it arthritis. It's actually arthrosis. So nope. The only thing not to do is to not do anything. You want to move your body. Movement is good for arthrosis and arthritis. You want to get that lubrication through the movement, the nutrients going to the discs through movement. The only not to do is to not move. So yeah. And we're at 1 o'clock. Let's see if I teased Meredith, so let's see if I can answer. Thank you for answering all my questions. We'll do everything suggested. 1 follow-up for help realigning SI joint. If I need it, what type of professional do you suggest to go to? I would suggest, I'm biased, but I would suggest a manual therapist. So that is a physical therapist with a certification in manual therapy, manual techniques. There are different certifications. I think one of them is called MTC, Manual Therapist Certification, or Certified Manual Therapist. That's one. That was the school I went to, so I am trained in manual therapy. Obviously, I don't use it very much, but I would trust somebody that has had specifically the I forget which seminar, but it was specifically on the SI joint for realigning and manipulation. It was like a 4-day seminar just on that. So, yep, I would look into a physical therapist that is a specialist in manual therapy, or the other words are manipulation, mobilization. Yeah. All right. Please talk about muscle energy techniques. Okay. I will in the future. Miss Tran, hot temperature in my glutes be the piriformis. The piriformis will be a little lower down than the upper glutes, Stian, so it's not going to be upper glutes. It's going to be right in the middle of your butt cheek, a little to the side, but up top to bottom, it's right halfway down. Okay, I think that's where we gotta go. Oh, Stian, yes, I can squeeze my glutes rock hard when standing, but not while in the back anchor on the floor. So that's good, Stian. You have nerve communication. So the nerves are not broken. So you got to build on the standing by practicing it in a slightly different position than standing. Maybe slightly squatted or slightly something different other than standing. You got to expand your ability to squeeze your glutes in other positions, and that is a skill you can learn and train your body to do. All right, I'm going to sign off because I know that if I keep answering, then the questions keep coming. And I think there's been plenty of opportunity to ask questions. So, man, I feel bad, though. I see all these question marks in front of me. I'm going to go ahead and answer them. But no more questions. I'm not answering any more questions after Joanna Dravnice. So, Fuzzer. Okay, Fuzzer, there is a lesson in the program, Module 6, the walking week. There's one lesson on walking up hills and a different lesson on walking down hills. So, yes, you will find that in the program. Steve Rogers, which exercises in your program are best if I have SI joint issues? So, butt buster bridge. I've watched your YouTube mini ad that talks about it, so get to the basics. How can I tell if my SI joints is hypo or hypermobile? Well, most SI joint problems, the vast majority, I'd say 80%, probably higher than that, are going to be hypermobile, just like lower back problems. It's part of the lower, is connected to the lower back. So L5-S1 is technically an SI joint. It's a LS joint. And then you have the SI joints. It's all that same location. That area tends to be overused, overmoved, and become hypermobile. So you want to stabilize. So the bridge, doing the bridge in the right way with core engagement. If you're not in the program, do the free trial, and that's what you learn in the free trial is my best recommendation for doing the bridge, and that will help. And then we add the butt buster progression to the bridge, which is the most beneficial thing that I know of on planet Earth for stabilizing a hypermobile SI joint. Crystal Small, my low back builds pressure. I have to lay down and do a prone push-up. I hear a loud pop and feel a shifting center and low below S1. I have sciatica 4 years post MD. Now, what could this be? Well, if it's below S1, then it's probably your SI joint, unless you have a floating S1 joint, meaning there's a joint between S1 and S2, but that's highly unlikely. And there's potentially just an SI joint instability, and that would be the pop. And the pop that you are seeking may not be something you should seek as often. So try to put space between the times that you go for that pop. an instability can cause pain, which would cause the muscle, or an instability, the muscles respond around an instability by tightening up. They're trying to stabilize. So you're feeling pressure in your low back. That might just be tension. And so then it's trying to stabilize. The tension is uncomfortable. You have pain related to the tension. The muscles aren't breathing as well. They're not getting the blood flow. That causes pain. So you want that pop to release, right, and get more blood flow and oxygen and reduce the pain. But then that's the cycle. So we want to spread that cycle out, lengthen the cycle by trying to do other things, other movement that doesn't provoke that pop. So go for a walk, or what other ways can you get blood flow into in that tight pressure in the lower back without going for that pop? Ask yourself those questions. What can I do? What seems to help? And how can I spread out these pops that I'm going for? Glenn, hi doc, after starting the program, the pain has moved from the upper left glute to the left glute, and now also middle of the lower spine and down into the hamstrings to the knees. Stopped at the end of module 1. Help. Okay, this is a different kind of question that I have not had in a while. So you have had a progression in pain. I'm glad I got to this question. Upper left glute. So that's where it was before. Now it's in the left glute, middle of the lower spine, and down into the hamstrings and knees. Stopped at the end of module 1. So it seems to me like module 1 caused this, and module 1 has some, unless there's other things in your life. I mean, there's obviously you're doing other things. So if there's other things that you changed recently, or did something new, or that's stressful on the spine, that could be a factor as well. But if not, if everything else remained the same, then module 1 has some lumbar flexion or lumbar forward bending in it. That may have caused a disc bulge that you already had. It wouldn't cause a disc bulge because there's not enough force to do that. It's very gentle stuff, but it may have pushed on an existing disc bulge that moved it onto a nerve. And that just because of the position of the bulge and the nerve right now, this may not be the thing for you. What I've found for people in this situation is, I haven't had a lot of people in this situation, but people who are irritated by forward bending, there's a lot, are often benefited by backward bending. And so I would consider some opposite movements. Module 2 happens to be the opposite of module 1. So people who have had some trouble with module 1 often really like module 2. So if you stay in the program, I would consider going into module 2 and seeing how that feels for you, and then returning back to module 1 if that when your body is ready. That bulge has to just move into a different position. And often the backward bending, the Mackenzie type stuff, can help with that, can help move a bulge or push it back into the disc. So, and I think his name was Tim can attest to that. So try module 2 or try some Mackenzie type stuff, and then you got to be able to do module 1. You got to be able to connect to your back anchor. So you want to gradually return to that when your body allows. Brianna, is there any way to know the difference between a flare-up of an old injury or a central sensitization of that old injury? I don't know. Yeah, I think there is one way. The only way that I could know is if there's a mechanism of injury. So a flare-up would be caused by more a physical flare-up, a physical mechanism, like, for example, a long car ride, or lifting tons of heavy boxes, or doing a sport and twisting wrong. Like, there's a physical mechanism. If it's central sensitization, it's probably going to be more not caused by a physical mechanism of injury, but potentially something psychological, stress, anxiety related type cause. This is not clear cut, so don't take what I'm saying as truth. Just use it as a way to help differentiate if you suspect central sensitization, which is, for anyone wondering, it's just the heightened sensitivity of nerves due to prolonged exposure to pain. Nerves that have had prolonged exposure to pain get better at sensing pain, so they get really sensitive. They require lower threshold of a trigger to go off, and sometimes that can even just be become a psychological trigger. So Joanna, is there any way to tell the difference? Look at the same beginning of the question. Whether it's SI joint or lower back issue, my physio thinks is coming from my back, even if it hurts where the SI joint is. Well, I wouldn't agree with your physio. I would think that one of the clearest signs of SI joint pain is the location of the pain. That's just my bias. There may be scenarios where it's lower back pain referring into the SI joint, but there's all types of therapists out there. Think of your profession, whatever your profession is, think of it, and then think of the type of people that also do the profession. There are ones that are really good at it, and there are ones that are not as wonderful. And so that's true for physical therapy. And I don't know your physio. It could be a phenomenal physio and be right on, but that's not, people, I think SI joint is getting more, people are learning more about it. And so it's becoming a more common diagnosis, but there are still those that are in the older ways. So, and Steve says he's in the program. So good to hear, because that was one of the things I was saying earlier. I said, if you're in the program, to this one right here. Yep, the bridge, and then the butt buster, which is module 4, but you can find it on YouTube. Just find, I don't know, butt buster or SI joint bridge. I would search that, and you can just find it on YouTube, because I make that one available because a lot of people need it before module 4. All right, so that's all the questions for today. Wow, check it out. Congratulations to Pamela for being the Student Hub Student of the Week. And looks like, is there some skipping going on? Maybe. Thank you, everyone, for being here. Thanks for leaning into your health. I do my best to lean back into you and provide the support. We went for about an hour and 15 minutes today. Hopefully you enjoyed it. If so, feel free to support the stream, hit that like button, subscribe, tell your friends, and we will see you next week. So until then, get down on the floor and connect to your core. Take care, everyone.